Good morning, good evening, good afternoon, ladies and gentlemen, Your Excellency, Ms. Lindiwe Zulu, Minister for Social Development of the Government of South Africa and Honorable Chair of PPD Board, Your Excellency, Professor Hasto Wardoyo, Chairperson of National Population and Family Planning Board, Government of Indonesia, and Honorable Treasurer of PPD Board, Professor Habib Ghadira, President Director General, National Board of Family and Population, Ministry of Health, Government of Tunisia, and the Honorable Secretary of PPD Board. Excellencies, distinguished panelists, representatives from national, regional, and international organizations and institutions, respected participants from across the world and from Indonesia, ladies and gentlemen. I'm really honored to be here today participating in this August Forum organized on the occasion of commemorating the International Women's Day by one of PPD founding and active member state. I'm also honored and humbled to speak at the forum after almost the entire PPD and senior panelists, governing board leadership, the chair and the treasurer, who have already and comprehensively addressed the central theme of the forum. This is an opportunity for me and my colleagues to learn and also to contribute to this important platform. Excellencies, distinguished participants, ladies and gentlemen, the International Women's Day is commemorated this year under unprecedented circumstances caused by the COVID-19 pandemic, challenging our health system and bringing back many of our achievements in economic and social sectors. As we contemplate and act upon transformative and sustainable response to these challenges, the attention to gender equality remains of paramount importance. Realizing the commitment of 2030 agenda to leave no one behind requires a solid understanding of the dimensions that shape women's experience of multiple forms of discrimination, including poverty. Women's disproportionate responsibility for unpaid care and domestic works places severe constraints on their time, limits their access to decent work, education, and healthcare, and in the absence of a supportive policy framework, can lead to the depletion of their capabilities. Women of the world want to and deserve an equal future, free from stigma, stereotypes, and violence, a future women's full and effective participation and leadership in all areas of life drive progress in all sectors and for everyone. Representation of women in the leadership and important positions are deplorable till now. Women are heads of state or governments in 22 countries, and only almost 29% of national parliamentarians are women. At the current rate of progress, gender equality among heads of government will take another 130 years. And considering the future progress for women, the theme for International Women's Day this year was selected as Women in Leadership, Achieving an Equal Future in COVID-19 World, aiming at celebrating the tremendous efforts exerted by women and girls around the world in shaping a more equal future and recovery from the COVID-19 pandemic, and highlights the camps that remain in force. This meeting is a great opportunity for the developing countries to discourse and unlock the immense potentials of women's leadership, putting into the immediate action towards achieving sustained and sustainable development. Excellencies, distinguished participants, ladies and gentlemen, during the Fourth World Conference on Women held in Beijing in 1995, participants highlighted the importance of addressing the unequal distribution of paid and unpaid work between women and men as an essential step towards achieving gender equality. A number of international human rights treaties, including the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention on the Rights of the Child, and the Convention on the Rights of Persons with Disabilities, contain legally binding obligation for state to address these issues. One of the main gains of the past 2 decades has been the increasing access for women and girls to education, with positive implications for women's and girls' life chances. In the developing countries, secondary education attendance is correlated with declines in early marriage and adolescent childbearing. Access for women to economic opportunities can enhance their well-being and amplify their voices with and beyond their household, while helping them to safeguard their families from economic deprivation. Having an income or assets of their own is also critical for women in cases relationship dissolution. whether as a result of divorce, separation of relationship, or widowhood. Although women can and do very often benefit from the earnings of household members through intra-household transfers, the ways in which such earnings are shared may not always be favorable to them. The benefits of sustainable development must reach everyone in order to leave no one behind. Women and girls who endure multiple and intersecting forms of discrimination, including on the basis of wealth, location, and ethnicity, are found to face the greatest deprivations, not only in one dimension, but across multiple dimensions of well-being. Social protection is recognized as a human right, including in the Universal Declaration of Human Rights. At its 63rd session, the Commission on the Status of Women stressed the importance of establishing and strengthening inclusive and gender-responsive social protection system to ensure full access for all without discrimination of any kind. For women empowerment, maternity protection is essential to the promotion of the health, nutrition, and well-being of both mothers and infants. By preventing income loss during such a critical period, maternity benefits enable women to rest and recover from childbearing and establish breastfeeding practices. By providing employment protection, women are able to maintain their connection to the labor market while being assured that they will not lose their job simply owing to their pregnancy or their having taken maternity leaves. Another fundamental component of maternity protection is effective access to medical care during pregnancy and childbirth, as well as postnatal care as a core component of universal health coverage. One of the key barriers to access to health services is financial. Affordable health care is particularly important for women because they typically have less personal income and face costlier health conditions, such as pregnancy and childbirth. Excellencies, distinguished participants, ladies and gentlemen, it's critical to reallocate resources to gender-responsive policies in areas such as social protection, public services, and infrastructure. In some cases, such as debt, servicing costs, there may be limited or no discretion for reallocation expenditure. And however, gender-responsive budgeting is widely used to guide the formulation of fiscal and budgetary policies aimed at enhancing gender equality. Gender-responsive budgeting involves an analysis of the gender-specific impact of the allocation of public spending, taxation, and the delivery of public services using data disaggregated by sex on the beneficiaries of various categories of spending or service provision and on the incidence of taxation. International cooperation in the forms of official development assistance also has a role to play in financing policies to reduce income poverty among women. Although North-South cooperation continues to be a primary source of official development assistance, in particular for the least developed countries and for landlocked countries, South-South development cooperation is on the rise. As financing for development continues to evolve, increasing official development assistance and financing from other sources for policies that reduce income poverty among women is critical. Partners in Population and Development, PPD, was established in 1994 during the International Conference on Population and Development, ICPD, in Cairo, Egypt. It was found with 10 founding members, including Indonesia, from developing world to achieve ICPD plan of action through South-South cooperation framework. By 2019, PPD has expanded its membership from 10 to 27 as a global intergovernmental organization, representing over 60% of the world population. PPD started this journey of developing country alliance, promoting a new paradigm of South-South cooperation under the leadership of an illustrious woman as the chair of the governing board. Always women had been in supreme leadership, and the immediate past and the current chairs of the governing board are women. This reflects PPD's commitment and priorities of the empowerment of women worldwide. PPD has ranked high in repute and earned worldwide recognition as a global leader in promoting South-South cooperation in reproductive health and rights, population and development. South-South cooperation is acknowledged as an effective alternative approach to achieve ICPD and 2030 Agenda for Sustainable Development in developing countries. The landscape of international assistance in the recent times has also been changed significantly with the emerging economies, most of them PPD member states becoming international assistance recipient and beneficiary. The outcome document of the second high-level United Nations Conference on South-South Cooperation, known as BAPA Plus 40, held in Buenos Aires in March 2019, re-emphasized the role of South-South cooperation in the implementation of the 2030 Agenda for Sustainable Development. At Nairobi Summit ICPD 25 in November last year, South-South and triangular cooperation was acknowledged as an alternative financial tool for achieving ICPD and the SDGs. Considering the 25 years of successful contribution of PPD to achieve ICPD and SDG, the next 5-year strategy of PPD is addressing unfinished ICPD agenda and Sustainable Development Agenda 2030. The PPD Strategic Plan 2020-2024 provides a conceptual framework of South-South cooperation taking into account its contribution, role, and development impact in addressing critical and emerging issues of reproductive health, demographic transition, and development. Again, in its strategic plan of 2020-2024, PPD has introduced prevention from gender-based violence and harmful practices, including early and forced marriage and female genital mutilation. The experiences gained by many PPD member countries in preventing gender-based violence would be shared with other member and non-member countries. By 2024, PPD aims at achieving that its member countries would strengthen their national policies and programs to eliminate all forms of violence against women and girls everywhere through South-South cooperation. PPD will support its member countries to have policies and programs on gender-based violence and harmful practices, realize CEDAW at national level policies and programs through sharing of best practices and information. PPD will continue to reinforce its program aimed at reducing maternal mortality and morbidity in the developing countries. Several initiatives undertaken by PPD member countries like Bangladesh, China, Tunisia, Mexico, and others have been proved to be effective in reducing maternal mortality through transfer of technologies and expertise. During Nairobi Summit in 2019, PPD also committed to work in achieving 3 zeros objectives: zero unmet need for family planning, zero preventable maternal death, and zero gender-based violence. In order to achieve the SDG targets, PPD has undertaken several initiatives, like the project reducing maternal mortality, which started implementing in Bangladesh, and to be followed by other countries in Ghana, Uganda, and other countries in the future. PPD, in collaboration with National Health Commission of China, has made several initiatives to share knowledge on prevention, containment, control, and elimination of COVID-19 in the developing countries. China has provided technical assistance to other affected countries with its own successful experience and technologies, with emphasis on protecting the women and children. Excellencies, distinguished participants, ladies and gentlemen, before concluding, I wish to share with you some ideas which I believe crucial to empower women and establish their equal leadership in all fronts. First, governments, stakeholders, and donors need to ensure more participation of women in the design, implementation, monitoring, and evaluation of social protection systems, public services, and basic infrastructure, with a view to enhancing effectiveness, efficiency, and responsiveness to their rights and needs, including through participatory assessment and gender audit tools that incorporate feedback from women and ensure that their priorities are taken into account. Second, it is also crucial to implement gender-responsive budgeting and strengthen monitoring and accountability mechanisms to ensure that budget support gender equality priorities and do not further exacerbate inequality or vulnerability. Third, governments should increase investments in education, health, and labor for women to build their capacities and ensure a better future for them, and not only relying on men. Number four, governments and partners should strengthen South-South cooperation, meet official development assistance commitments, and ensure that investments in social protection, public services, and sustainable infrastructure made with official development assistance are directed towards the achievement of gender equality and the empowerment of all women and girls. And finally, that global solidarity and South-South cooperation are needed now more than ever to address the challenges related to the COVID-19 pandemic, like diagnosis, treatment, prevention, control, surveillance, vaccination, epidemiological investigation, and many other activities that are needed. Before finishing this intervention, I would like to thank the organizers for this brilliant webinar commemorating the International Women's Day. We have learned a lot from a senior panelists. Thank you all. Thanks to BKKBN for your continued commitment and support to South-South cooperation. Terima kasih and thank you.